So very briefly then, I won't talk about the TCPA, but what we've done in the past around health and planning is really around capacity building, providing guidance, doing practice-based research, and then just raising awareness of the health and planning issues. I know definitely when I come and speak at events in London, London's always a special case. You have TfL, you have Lucy, you have the GLA, and actually outside of London, there isn't that kind of structure and support to support local authorities. So actually you're quite in a good place in London around some of these issues. So I'm pretty much preaching to the converted, and you already have a lot of support anyway in London. So I guess take my presentation as the key principles around the planning system, around planning healthy weight environments, rather than specifically what you can and what you can't do in the London context. But we have done a lot of workshops with local councils. So these are specific workshops with councils, with their partners in public health, planning, transport, environment, and recently the developers and house building industry around how they are approaching the health and wellbeing agenda. And actually, the more I do these projects and do these events, it's actually a lot of the messages are aiming back to public health and say, you don't understand the system. Actually, we are doing everything that you want us to do for the last few years. You just need to know what we're doing and then trying to align our priorities. And I'll try and explain why I say that. So, and then Sarah showed this. I think the two key findings from the Foresight report around planning was quite narrow. It's around promoting physical activity and limiting, access to fast food takeaways, and that's great. These are two things that planning can have some influence over. But I'll demonstrate later on. Actually, there are a few other things that we can have influence over to affect reductions in obesity. And from that piece of work, we did a piece of work back in 2014 with Public Health England and a lot of other partners around planning healthy weight environments. So you've got a whole Foresight report around these whole systems interventions. But what about the planning system? What about the place-based approach to promoting healthy weight environments? And we came up with this kind of 6 elements of healthy weight environments, which you can think about, and then don't take them as standards or really quite, if you like, concrete things to do. Think about using them to engage with, say, town planners or your transport planners around these issues and highlighting where the gaps could be or where you are already doing things, but actually you need to be promoting other areas of interventions that's probably not planning related, but this is all very much planning related. And I'll go through 2 or 3 of these very briefly around physical activity in the food environment. So firstly, and again, we have transport planners in the room. I think this is all quite obvious. To be honest, all the stuff you all know about. If you look at planning policy, it's quite straightforward. But movement and access is around, obviously, how you get around a city or how you get around your neighborhood. And there's a lot of evidence already out there, and I won't go through all of that. You all know about it. I guess the key planning issues for you to try and influence planning policies in your local plans or in development proposals is looking at, for example, the walking and cycling environment, urban design of a site. How do you move around a site? Can you see a site? Restrictions of car parking, for example. That's where sometimes we conflict with local planning policies because elected members like to see more car parking in some areas. Developers like to see more car parking in areas, whereas we are promoting reductions rather than saying no car parking at all. Obviously, as Sarah said, if you have no access to cars, you're more likely to be active than not. And really basic things like accessibility and signage issues. If you don't know where you're going, you're not going to be going there. And particularly for certain demographic groups, if you feel unsafe, you're not likely to kind of go out and move around. Around access to healthy food then, this is where, again, is quite a weak element of the planning system. And again, I want to move away from just talking about fast food takeaways. It's about production and consumption of healthy food, for example. So yes, takeaway is one element of it. Some areas, like in Merton, they found that actually they have no issues with takeaways in terms of planning. And so it's really up to local boroughs to think about how and where they want to use planning powers to tackle a healthy food environment. But there are other areas around production. So how do you provide for allotments, areas for growing, back gardens, all those kind of areas with no developments that can help people and encourage them early on in their life cycle with moving into a new home to be growing food, for example, or having access to a market, and all those things are all relevant to the planning realm. These are all quite general examples, and there's nothing that planning can't do, but there's a lot of things that planning can and can't do. I think it's the kind of key message really is for you to think about what works and what doesn't work in your boroughs, rather than me telling you what you can and what you can't do. Neighborhood spaces. Now, this is again focused on the public realm, and again, I think a lot of these things do align with Lucy Saunders' Healthy Streets for London, but that's another issue. I think for developers, they are confronted with many, many different standards, even from the TCPA, around some of these healthy environments, and they need to know where they align, where they don't align. So in London, you have TFLs, Healthy Streets for London. You have the London Hoodoo work as well, and you have active design by Sport England, you have other things from other people, and I think you need to be very, very clear what you need for your local boroughs. But for this one anyway, it's around obviously provision of social infrastructure, and healthcare is part of that. So I think it's about providing the needs that you do need for your healthcare, but also the accessibility, how you get there. You don't want a new hospital or a new GP surgery in the middle of nowhere you can't access, or it's in a really bad area. So those issues need to be considered in the town planning world. But more importantly, the public spaces and public realm elements of it. So how do you encourage developers to have a really inclusive public realm design? That's not just about dementia-friendly designs or age-friendly designs or child-friendly designs. That meets everyone's needs. The planning is about a population change intervention. We're not here to provide a certain specific intervention for a population group, because you will exclude others in that as well. So for example, you have recently a report around air quality, air pollution, and I think academics were suggesting that you actually plant hedges right next to footpaths to capture all the air pollution, which is great for air pollution purposes, but for secure by design from the police, they're suggesting you plant trees, not hedges, because you can't see through hedges and you feel insecure in that area. So I think it's about conflicting standards currently in planning, which we have to tackle with nationally and regionally. So very briefly then, planning is a key delivery tool. I think people don't recognize that planning, we don't have our own agenda. Our agendas are set by national government. So if national government wants to deliver less housing, we deliver less housing. Want to deliver more housing, we deliver more housing. If the health sector wants to emphasize more on the health and well-being, we'll do exactly what you tell us to do, as long as within legal parameters. So I guess this is a really key quote about planning is part of the solution. It's not the only solution. And I guess my point really is about this. And I think if you look at the history of planning and housing and public health, where we all began, 100 years later, we are still thinking about these issues, about the legal powers that we do have in planning that others in the health sector need to be aware of. Obviously, there are a few issues in the past around public health not being local authorities and they're out of the loop. But now you're back in local authorities, you need to be very, very aware of the legal powers you have as a local planning authority and as a local authority. So that's where that quote comes from. So planning education then, and planning as a profession, we have always thought about health and well-being, just not in that kind of way. And I'm sure transport planners do as well, and housing as well. But I think having a good focus now around why we do planning now is really important, because we're not here to drive housing units. We're here to provide homes for people, healthy homes for people. So having public health involved in the planning process really helps us to reawaken our sense of purpose, if you like, around the whole planning and for health agenda. But we are not just dealing with public health in the work, as Sarah said. We have to deal with elected members, as you know about, other special interest groups, developers, communities. So to be honest, public health voice is one of many we have to balance out. So if you would like us to do something, we'll say yes, thank you very much. We'll take your evidence and we'll consider it. The outcome might not be the one that you like, but we might have a really good relationship, but the outcome might not be the one that you are seeking for in terms of having a policy around takeaways or whatever. But just be very, very aware of that we are here to mediate different interests. Planners are a generalist among specialists. We're not here to tell you what to do, we're here to deliver what you tell us to do by balancing different things. Planning is a discretionary, system in the UK. We're not a zoning system like America. We can specify no takeaways in this area, as in the block, fine, but we don't work like that in the UK. So in terms of policy then, I think, Sarah asked all you questions around, have you got, place streets, have you got, beat the streets, and you all pretty much have those in your London boroughs. I'll ask a question to you. Do you know what's in your your local plan, policies around active travel? Those who do, apart from demanding. Apart from those who know, okay? So I think the issue is that there are policies in there at the moment that you need to be aware of that demonstrates that we are doing the things that we are meant to be doing, say around the whole active travel situation, but you need to be aware of how that fits in with your health and well-being priorities. So I referred to the National Planning Policy Framework 2012. So this is 2012, it's 5 years ago when government published this document. And there are a number of different things in there that actually, if you can quote paragraphs to your town planners, they'll be really impressed. And I will quote, I would suggest you quote 2 paragraphs. Paragraph 17 of NPPF says that planning is meant to be delivering or taking into account local health strategies. So if you tell your planners, have you, in your local borough plans, have you thought about our health and well-being strategy? If you say no, well, there you go. Paragraph 17 NPPF tells you that you have to do that. Secondly, paragraph 171, okay, health and well-being needs and these are JSNAs. And then we have to take into account your JSNAs in your local plan making. You go to your town planners and say, does your local plan refer to use our JSNAs? If they say no, well, there you go, paragraph 171. I think these are some of the things that we do have to do in planning. Either we don't know about it, or you guys are raising awareness to the planners about some of the things that we have to do. But there's only 2 paragraphs of the whole NPPF. There are references to our health and well-being indirectly through the whole document: open space, air quality, recreation, housing, economy, everything's all in there. So I guess your point and your job really is trying to find out what's in policy at the moment that can help tackle the obesity crisis, and then that we do and find the gaps and where the gaps are. And the TCPA has produced a checklist actually to look at the NPPA policies against what you can and what you can't do from the health side. Now, your health and wellbeing strategy is really interesting because we did a piece of research back in 2015 with the London Healthy High Street group around all your London Borough policies. It might be slightly out of date. Some of you might have progressed since 2015. But there are 16 borough health and wellbeing strategies who have no reference or links to planning the built environment. So if you go back to paragraph 17, that if you have no priorities or actions around the built environment, obesity, how are we meant to take into account those issues in planning? Before boroughs have specific actions to address these physical activity, things are quite specific interventions. So these are not systems thinking around obesity or place-based thinking. They're about specific activities around takeaways, around cycling. They're not quite the kind of population level we're hoping for around systems thinking. 2 boroughs seek to address health through HIAs, that's great, and 1 borough seeks to address obesity issue through restricting takeaways, and all the other boroughs don't have anything along those lines. So I guess from the planning side, that is quite concerning as a planner, because if the health sector isn't clear about your own priorities around the built environment, to bluntly, don't expect planners to be thinking about it at all. So that's kind of the message out there. So in terms of examples then, so these are from outside of London. So you have in Worcestershire as a county 2-tier level, obviously it's quite different to London. They've opted to go a different route. They've opted to do a separate JSNA from the planning world. So they've got their own JSNAs, but the planning team thought we need to do our own JSNAs in the planning speak, so our planners can use it. And so they published this document back in 2015, and then using it to inform planning policies in their county, using it to enable engagement activities, to common opportunities in their county. So it's quite an innovative way of using the existing system to promote whatever health and well-being issues they want to tackle in their county. Health in policies or health in one policy. I guess I really have no view. You're probably expecting me to say health in all policies, please. But actually some councils think that having a specific health and well-being policies focuses people's minds on health and well-being, or obesity in this case. But there are other councils who think that, well, we would like to mainstream health across all our policies rather than saying we have one health and wellbeing policy. And so I guess really up to you. A lot of you will know your local borough, local plans and see what policies you have around health and wellbeing. So I won't say anything more about that. I guess the issue is that you need to be clear about what you want, because in planning, we do know what we have to do from an MPPF, and your job is trying to latch on to that. And then finally, I think checklists. And I think, again, you're very well catered for in London. You have a London Hoodoo checklist. You have, Lucy's Healthy Streets for London checklist. But I think the issue really is around practical implementation of these checklists. Having these checklists, if they obviously, they won't work, they contradict each other. So if the active design checklist by Sport England don't align with Lucy's checklist, and how does that align with the developer's planning application? Who was undertaken by it? Are you expecting the developer to pay for someone to do that HIA, or are you expecting your public health team to do the HIAs? It's obviously material consideration. We have to think about it, but like I said, if obesity is raised in there, we'll highlight it as an issue. We won't say it's a priority issue unless it's a different matter. And then finally, who monitors and who assesses it? So if developers do an HIA, submit it to planning authority. Do you, public health, want it? If you want it, fine. If you don't want it, then who wants it then? Who wants to assess it and use it for the benefit of the borough? I would say, the issue around, like I said earlier, balancing different interests, whether obesity is a priority or not. I guess the issue really is around the whole planning appeals process. We've found actually different cases in case law around planning inspectors not thinking about the obesity as a priority issue. But the main point from case law is that actually for obesity to be taken account seriously by a planning inspector, by the government, when there's a planning appeal, is that it has to be a cross-bar approach to tackling obesity. It's no good having just a takeaways policies around tackling obesity through restricting fast food takeaways when your own corporate strategies don't mention obesity, when your own health and well-being strategies don't mention built environment and obesity. There are cases where they have been dismissed because of that. It's quite a narrow planning intervention, and planning inspectors say, well, that's not the role of planning. But in cases like I think in Newham and other cases where the planning inspector found a wide range of interventions undertaken by local governments, then they feel like, yes, planning is part of the solution, so we will allow the appeal, for example. So those issues are really quite important in implementation. So I've gone through it quite fairly quickly, the whole planning system, and I think the issue and the strength of today is to find out from you, what you need to know. As with all these presentations, I'm giving you information. I don't know what you do know, what you don't know. But I think if it gets super complicated, relationship is always quite useful. Go and speak to your public health person, go and speak to your planners about things, and ask them questions. They quite happily answer questions from you. But relationship is really important because they build the structures, not the actual systems and policies themselves. So I'll leave my presentation at that. Thank you.